And good evening and welcome to another edition, the Groundhog Day edition of Right to the Point here on TVCogeco. Darn little rodent, and what he saw today. Well, actually, he did us a favor today. He didn't see a shadow, so we're in for an early spring, so they tell us. Although when you look outside today, you'd never know it. Sue Deneby is with us today. Sue is the president and CEO of Bluewater Health. A little later on in the program, we're going to talk to Helen Cole. Helen is with the local chapter of the Canadian Cancer Society. They have a brand new program that they're starting up. A little later on this month. We're going to talk to Helen about that in the second half of the program, but we wanted to focus the first half of the program with Sue, and thank you very much for taking time to
Thanks for having me, Barry.
We wanted to focus on the 100th anniversary of CEEH Hospital in Petrolia. You were at the anniversary celebrations this past Saturday, the 29th. The actual date of the 100th anniversary was Monday, the 31st of January, 1911. Tell us a little bit about the events on Saturday past.
Well, the event on Saturday was quite casual. It was a gathering at the Victoria Hall, and I would estimate that we had well over 100 people. We had the local politicians, the mayor, the MP, the MPP, and a couple of the wardens, and they all gave greetings. We had a lovely speech written by one of the high school students for a speech this year with respect to Charlotte and Jake, and it brought tears to everybody's eyes.
Right.
It was a very nice speech of their lives together and the love story between the two of them. We had treats and snacks, beautiful music, a band played music. And it was just a lovely afternoon, a couple of hours just to kick off the events of the anniversary.
We just saw, as you were speaking, we just saw the picture of Jim and Dana Churchill are the individuals from Petrolia who dressed up as the Engleharts. But I noticed that you didn't get dressed up. I thought maybe you'd be dressed up as someone.
I didn't get the memo. No, I didn't. And that was really nice as well in the period costume. Dana is blonde, I noted, and Charlotte was dark-haired. We also, in the room, had a number of display of artwork that the local high school students have done with respect to the periods of healthcare as well as the Engleharts as a couple, and that was quite nice. There's some excellent artwork.
And I believe they're still up at Victoria Hall now, so if people are around the area and want to check that out, they can see those. Tell us a little bit about, and you know, I don't want to put you on the spot as far as your historical background is concerned, but give us a little bit of flavor, because it's an interesting story as far as how the Charlotte Engelhart Hospital came to be in the first place, right? I mean, it hasn't always been a hospital, right?
No, it hasn't. It was a mansion in those days, built by Mr. Engelhart, and it was called Glenview, and he owned the property behind it as well. And he owned that for a number of years before he actually re-met, I guess, Charlotte and married Charlotte. And they married in about 1891 and were married for about 17 years before she passed away in 1908. I believe that date. Don't quote me on those dates, but I'm pretty close on those dates. He had started Imperial Oil and had other interests as well, and had interests in other areas, both in the province and in the United States, and was out of the town for a bit, came back. Charlotte was a young lady at that time, and they fell in love and got married. Charlotte had beautiful gardening skills and grew gardens, and he gave this mansion and the properties to her. And unfortunately, she died, according to the love story, during childbirth. And she bequeathed the property to be used as a hospital from that day forward. And so from that day forward, actually opened as a hospital about 3 years later. And it's been used as a hospital ever since.
Right. Yeah, and we were talking off air before we started. Started with 2 doctors. So
two doctors and 13 beds.
You think back to that period of time. I mean, you know, whether the doctors had vehicles or horse and buggies or whatever, we're not sure. But obviously, they just kind of made the rounds.
Horse and buggy.
Yeah. So.
And then later on, he actually donated a significant amount of money for an operating theater and obstetrical unit. So a significant addition again to the hospital.
Your fine communications team at the hospital sent out some information prior to the day last Saturday, just giving us a little background. We understand, I guess, from the information that the hospital came into being in 1911, as you mentioned, but it had been sort of in the works for a number of years prior to that, right?
The town folk had been lobbying the mayor to start a hospital, and of course that was in 1901, and so when she passed away in 1908, she bequeathed that property to the town to be used as a hospital.
Right. Give me a sense, as you were at the celebrations last Saturday, you know, it doesn't matter if it's an individual that turns 100 or you know, a house that turns 100 or a hospital that turns. Give me kind of a sense of what you were feeling, because that's a pretty significant milestone, no matter where it is, right?
It is, and it's a very significant milestone, and it's a significant milestone that the original part of the original building is still part of the hospital. It's wooden, it's got a beautiful turret, it has a beautiful front parlor in the building, and the original, well, not the refurbished stairway that goes up to the second floor. So it has a number of historical artifacts actually in that building even today. And it's just gives you the sense, and seeing the people to come, the townspeople are so, the town of Petrolia is so supportive of the hospital, then to have them all come out, it is really quite an astounding event. It's quite moving.
How many other, and I don't want to put you on the spot as far as information is concerned, but I mean, are there other hospitals in Ontario that are 100 years? There can't be very many.
There wouldn't be very many. Healthcare has changed significantly over the 100 years, and amalgamation and mergers, and 100 years in terms of age of a building is significant. The buildings that we're in Sarnia, the one wing, one piece of the wing is just 100 years old. The rest of it is of a significant age, and it's in the late 50s.
Right.
So.
The
100 years is significant.
The only other one that I could find at a very rudimentary search of Ontario, the only other one I could find that was 100 years old was in Lindsay. That was the only other one I could find. Now, I'm sure there's others, but I just
Well, I've been in the Lindsay Hospital. There's not much of that building left that would be 100 years old.
They just actually did a lot of refurbishing there.
They did a major construction in the last 10 years.
As was the case, obviously, with Bluewater Health. So there's not a lot, as you say, not a lot of the original left, but Petrolia has a lot. You mentioned about some of the other events that are upcoming. With as the year goes on, you know, obviously the kickoff event was last Saturday, but then various events as the year wears on. And the next one, you mentioned the
next one is May the 14th.
Exactly. And she was quite a gardener, so
there's a memorial garden that will be dedicated, and there will actually be, there's an actual statue that's currently being built of Charlotte and Jake that will be dedicated, and the garden will be dedicated on May the 14th. Then in June, there is a strawberry social. I believe that's a Sunday, June the 21st, so that's a Sunday. And then it will culminate with a major gala in November to bring the events to a close.
Right. Now, you mentioned June 21st, but my notes say June 12th. Is it June 12th or 21st, whatever it is? We'll double check that.
Check the website.
Check the
website. Check the weather. And
check to see which one is the Sunday, I guess. Eh? So, yeah. Give me an idea. You talked about how the people in Petrolia are so supportive of the hospital, and I know firsthand that that's indeed the case. Is that sort of prevalent in small town Ontario, or people are maybe hold things a little closer to them?
It is, and I'm sure that for many, many years the hospital was probably one of the prime employers. I'm not exactly sure how many employees the oil industry would have, but for many years it probably was the largest employer. So it's very core. It provides an essential service to the people who live there. It provides a bit of a support and a network for the people who live there. So they've been very supportive. The foundation, the members of the foundation have been members for a number of years. The foundation has raised well over $2 million. As well, there is Mr. Engelhardt. When he passed away, he bequeathed a significant amount of money and Imperial Oil shares. And to this day, that donation is still in trust, it's held in trust, and the interest is used to go back into the hospital.
Right. When you think of 100 shares of Imperial Oil 100
then,
years ago, and then what they're worth today, they've obviously made a few dollars on that, obviously through that bequest and so on. So that's a lasting memorial right there. We're going to take a break. By the way, we should remind you that there was going to be a public meeting in Petrolia today, Wednesday the 2nd, to do with some of the sort of vision of the future of the hospital, and because of the inclement weather it got cancelled. There, to my knowledge anyway, there hasn't been a rescheduled date as of yet, but they're asking us to sort of keep an eye on the Government of Ontario website, Ministry of Long-Term Care, and they'll hope to have a rescheduled date soon. So that was to take place at the high school today, but since the high school was closed and the panelists couldn't likely make it here, they decided to reschedule. So we'll keep an eye on that, and we'll fill you in on subsequent shows when we have that date to pass along. We're back with Sue Denemy after this. You're watching Right to the Point on TVCogeco.